For our next conversation, we're going to look a little bit more closely around health and well-being in particular, and the need for partnerships and collaborations to help support those efforts. So please welcome to the stage Leadership Council member and president and founder of the Wellbeing Foundation Africa, Toyin Saraki, and Dr. Chini Ogunro, CEO of Wellspring Health. Dr. Ogunro?
Hello, everybody. How are you? It's very nice to meet all of you, and thank you for having us here. I'll hand it over to Mrs. Saraki to give the proper introductions.
Thank you very much, Chini. Good evening, everyone. I'm Toyin Ojora Saraki, founder and president of the Wellbeing Foundation Africa, an advocate for global public health advances, the rise of women, economic empowerment, and access to water, sanitation, and hygiene. Chini, who I have met as a young lady, extremely competent. Chini Ogunro, CEO of Wellsprings Africa, please introduce yourself.
Hi, everyone. My name is Chini Ogunro. I am the CEO of Wellspring Health. We are focused on providing affordable primary care services across the African continent, and I'm thrilled to be here with all of you, sharing the knowledge that I have developed working in healthcare on the sub-Saharan African continent over the past decade.
Thank you very much, Chini. I'm really honored tonight to announce my Wellbeing Foundation Africa as a partner for Concordia 20 as we introduce and discuss delivering stronger collaborations for better health and well-being. Our goal to improve public health in Nigeria, especially amidst COVID-19, requires the might of an international body of experts, and I look forward to driving progress with you at Concordia Summit. Ensuring good health and well-being for all is necessary to achieve the Sustainable Development Goals by 2030. As we all know, this 2030 deadline is a deadline that we cannot miss. To achieve the global goals, we have to accelerate country progress on the health-related targets of the Sustainable Development Goals. And actually, recently, I've just responded to UNICEF's very dire report that Nigeria must strengthen collaborations and resilience to move ourselves in our current position as being the top contributor to under 5 deaths as measured in 2015. It's actually quite encouraging that within those dire results, the 2 states that WBF has achieved program saturation actually have the lowest under 5 mortality in the land. The challenge that we face is the same challenge that we have faced all along. How can we translate the global goals into tangible actions that will bring impact on the ground? This translation is only possible when we commit to building and nurturing strong collaboration, both within and outside, with the healthcare community. If the Sustainable Development Goals are to be realized and health and well-being are to be improved, collaboration is essential, and this includes collaboration between the international organizations engaged in health development and humanitarian responses, the private and public health sectors, which we have proud to have worked very successfully with over the years, and we have achieved sustainable and scalable impact at the grassroots level. We need to collaborate with ministries of health because countries need to work together to identify health priorities and plan where to invest their resources and effectively implement this for better health outcomes. We need to look outside the sectors, first within the global health sector and outside to the finance, technology, education, and infrastructure sectors. These cross-sector partnerships are so essential to achieving sustainable results at the grassroots level. We've already seen the potential impact of cross-sectoral collaboration to accelerate the implementation of the SDG agenda, but we also wish to leverage on the opportunities that will strengthen joint advocacy for improved health financing, and we hope that this will be through agencies like the World Bank and the Global Fund. It is only by acting together that we can achieve gender equality at the local, national, and global level. And we know that gender equality improves health and well-being for all, which will move us closer to reaching our ambitious but achievable targets. Recently, we actually started a campaign to increase women's participation in health leadership and build a pipeline of progress in Nigeria. Over the next 10 years, it's imperative that we not only nurture existing collaborations, but continually strive to build new ones. At the Wellbeing Foundation Africa, we know that collaboration is the new competition. Nowhere is this more evident or even more necessary than in the health and well-being community. Innovation and technology have strengthened collaborations within the healthcare sector, but it's crucial that the key stakeholders continue to build on this momentum to create the collaborative, conducive environment to achieve our goals of offering an affordable and accessible comprehensive care model to uphold our 10 pillars at the Wellbeing Foundation. The pregnant women and their families must receive the right care at the right time. Newborns must receive essential care immediately after birth. Small and sick babies are well cared for in the neonatal intensive care unit facility, that all women and newborns receive care that prevents hospital acquired infections, that health facilities have an appropriate physical environment, and that communication with women and their families is effective and responds to their needs. Women and newborns who need referrals should obtain them without delay, and no woman should be subjected to harmful practices during labor, childbirth, and the early postnatal period. Health facilities should have well trained and motivated staff consistently available to provide care, and every woman and newborn must have a standardized, complete, accurate personal health record to actually make her an equal partner that is empowered to get the best care for herself. So I'm going to hand you over to Chini, who is my collaborator, in lighting the path on how our unique collaborative model will deliver and achieve comprehensive community care and a healthy future for all. Over to you, Chini.
Thank you so much for that wonderful and informative segue into the aspects of comprehensive primary care that I wish to speak on. So, in my discussion, I want to really give an idea of what comprehensive primary healthcare, what that model look like. The reason that doesn't yet exist is not necessarily because nobody has invented the idea of comprehensive primary healthcare. It's more so because it's very difficult to figure out how to do that model at the locally affordable price point. What we're developing at Wellspring Health is really a way of cost engineering. We start with what people can pay and we design backwards the best service possible to deliver at specific locally affordable price points. The way we've set this model up is really thinking through who can afford the type of healthcare that is required. We've really looked through private primary care and also tried to understand where is the best quality. Is it in the public sector? Is it in the private sector? But it's not necessarily a matter of public or private. It's really about the people who need access to formal care are typically stymied in whichever type of facilities that they go to. So using our cost targeting approach instead of figuring out how much our services costs and adding a margin, we start with the prices and we understand what customers are willing to pay. And we've now solved backwards for the best quality product that we can possibly offer. That is how we approach healthcare at Wellsprings. Now, I want you to really think of a typical patient journey. I'm going to use a young lady named Kemi. Kemi is from Nigeria. She's 20 years old and pregnant with malaria. She works in the informal sector and she doesn't have a lot of money to spend on healthcare. Her time consuming healthcare journey typically starts with the cheapest option. Kemi goes to a traditional birth attendant for maybe her basic antenatal care and some of her drugs. But oftentimes that may not be sufficient or it may not be the type of quality that her particular condition needs. She then moves on to a PPMV, a proprietary medical vendor, and is able to continue her journey at the lowest end of the spectrum, getting relatively inexpensive drugs for about $2. If this aspect doesn't work, she has to continue her journey to a formal pharmacy where she will now pay typically about $5 for that same malaria drug during her pregnancy. If this isn't for her care needs at that point in time, Kemi now has to go on to a primary care center and have services delivered at about $78 for her care. These multiple stops, these multiple places that take place in the typical patient's journey are not sufficient. It is not how we want to treat patients right now, and it's due to the lack of quality care we have in our system. But we learn a number of lessons. We know that we need to meet patients where they are at the point of their need and recruit and design from that first point of contact. We also know that we need to provide comprehensive offerings with transparent pricing, and really that we need to provide continuity of care through patient onboarding and follow-ups. Wellspring Health is all of this. We provide the pharmacy services that Kemi might need, the diagnostic services that her unborn child may need, but also the core clinical services of basic primary health, maternal and child health, malaria, immunizations, and importantly, acute surgical care, because things like cesarean sections must not be ignored. So, for this sort of model, how is it revolutionary? We ensure that we are tied into the broader healthcare system. At Wellspring Health, we are tied to the HMOs, we're tied to the public PHCs. We can receive referrals from public PHCs and out to other federal medical centers or state hospitals and advanced private facilities. We also integrate with the informal providers because this is essential. We can't simply ignore the informal sector because we don't like their quality. We have to tie ourselves within the informal sector to say, hey, if you're not providing the right type of care, send your patient to us. Or if you're facing a complication, send that patient to us and we'll be able to manage the complication. This is how we imagine comprehensive primary care, having the pharmacy services, the core primary healthcare services, as well as the diagnostic services, all within the same location in order to best address the patient's needs. And this is the core of how you deliver care to the base of the pyramid. We're not talking about just the richest aspects or the richest segments of the population receiving care. We're talking about everywhere from the middle income population down to the lowest income populations, the base of the pyramid. We want to make sure that every man, woman, and child across different economic segments are able to access the right type of care, but appropriate care. Unnecessary expenses are whittled out, and we drive operational efficiency to ensure that our price points are able to be achieved. So this is the essence of our model. This is what I'm excited to share with you today. And I know that Saraki, you know all about this. You've done it for so long with Wellbeing Health Africa, and we're just really excited about what's happening.
Thank you very much, Chinny. You know, the one thing that I've always said whenever I'm advocating is that some of us are very used to growing up having choices in healthcare. But to make people understand the importance of this Wellsprings model, what I always say is that if you have a car accident on a journey in an unexpected place, you are taken to the nearest health facility. You won't have the choice, and you are at the mercy of whatever they have where they take you to. I'm hoping that the Wellsprings health model, as it rolls across Nigeria, even though we are targeting giving comprehensive care to the base of the pyramid, I would like a Wellsprings center to be the sort of center that I would be proud to be taken to myself, or to even choose to visit myself for my own care. I'm hoping that the 8,000 women that the Wellbeing Foundation Africa's midwives provide a care continuum of counsel to in our free antenatal classes every month are the same 8,000 women that will grow and mushroom across Nigeria who will choose to enroll in a Wellsprings health model for their own care. I've always believed that we need to move the nation beyond a primary health system that actually only responds in a limited manner to emergencies, to actually a system that can provide a healthy future for all because it's trusted, provides value, and is near enough within people's communities for them to adopt it as theirs. I'm super, super confident about this model. And then when we look at the health workforce angle, I certainly know that some of the projects that I have done in the past and still ongoing, for instance, the training of a skilled health workforce in emergency management of obstetric and newborn care skills, we've saturated one state with that training. And it's no coincidence that that is the state with the lowest preventable mortality in Nigeria. And I'm really hoping that the Wellsprings Health, medical teams will be trained in this. If I go back to Kemi, I would say that today a Kemi in Nigeria only actually goes to a health center if she has exhausted every available option that's open to her. Once Wellsprings Health is open, I would like to think that Kemi, even from when she is a teenager and needs advice, would find this new comprehensive community healthcare model a place where she can come for learning, come for care, come for advice, a safe space, even a place where we could offer sexual health services and referrals so that through this community based care, we can actually tackle a lot of the unmet needs that our country suffers in a way that's available and accessible to everyone. I'm very grateful, Chini, to have you as a collaborator in making this dream come true because I know it's an achievable dream. I know it will be an accessible dream, and we will actually bring this to life across the nation. I think it's very instructive to say that the first state that we approached, thinking of doing just 6, immediately came back and said, well, can we have 33 of them? So now it's time to look at the economic aspect, raise the fund to make sure that we can get this done. And by 2030, we can actually hit that goal of no preventable deaths. I'm very happy to have you as a partner, and I'm very pleased to have the might of the members of Concordia because achieving this goal will require the collective might of an international body of experts, as well as a reinforced ground force, as I call it, in Nigeria, to actually put it in context and make it real.
Yes, most definitely. And I'd like to thank you for always having had this dream for quite some time and working diligently over the years in order to ensure that you're not just talking the talk, but you're also ensuring that you walk the walk. And with this initiative and with the many initiatives that you've done, it's certainly putting not just pen to paper, but actual feet on ground and how do we say concrete in the soil to ensure that things are moving forward. So I'm pleased to be here to have spoken with the rest of the Concordia and General Assembly audience, and thank you for having me at this time.
Thank you very much, Chini. And I will encourage us with one thing. In 2007, I wanted to have a health insurance policy that would be less than $5. Everybody said it was going to be impossible to do, but we did it and it covered pregnant women and their newborns. We can do it again.